Hi, my name is Dr. Max Zubatsky along with Dr. Sue Tebb. We're here today to talk about Caregiving WellBeing. This is part of the Geriatric Workforce Enhancement program where we'll discuss some techniques that healthcare professionals can use when working with caregivers in their practice. This project is supported by the Health Resources and Services Administration. Caregivers come from all backgrounds and demographics. As you can see, not only from race, ethnicity, and gender, but also by age. The disbursement of ages across different caregivers is numerous. You can see by the statistics here that almost 80% of caregivers are 45 years and older. That means that many caregivers are not only caring for their loved ones, but also children and others in the home. This can create some challenges as far as the future of caregiving, because many more caregivers will have to step up and take care of the needs of their loved ones with the disease. One of the unique aspects that healthcare professionals can look at is what phase of the disease we can meet with caregivers. Oftentimes we do a lot of approaches of a one-size-fits-all with caregivers, but one of the main features we need to look at are the time phases of illness. So this shows time phases across the crisis, chronic, and terminal phases. At the crisis stage, this is where healthcare providers should intervene in explaining more about the diagnosis, making caregivers and family members feel comfortable about what the course of the disease will entail. Other areas will be talking about different medications, about what the course can look like for the family, and relieving a lot of the stress and anxiety that comes about. The next phase is the chronic phase. So after the first year or two, caregivers run into what's known as the long haul phase. This is often where a lot of anxiety, burnout, and compassion fatigue come into play for caregivers. Healthcare professionals need to be aware of not only treating the patient's symptoms, but really assessing and looking for the well-being of the caregiver over this long haul. The final phase is the pre-terminal phase. This is usually when the patient has more advanced symptoms taking place or there's transitions into higher level of care. A lot of this communication talk will be around not only family involvement for the caregiver, but also certain financial considerations, areas for long-term care, and how the caregiver is going to relate to the person near end-of-life issues. In addition to working with the time phases of illness, it's important that professionals look at the life cycle stages at where caregivers are at. As you can see in this timeline, there's 4 specific phases in which caregivers can not only relate to the quality of their caregiving, but how they're interacting with their family during that time. For instance, caregivers in younger adulthood will not only be preparing for their own job and career, but also how they take care of their loved ones. This can be a challenge because someone may be limited as far as mobility, having to take care of a loved one in close proximity. When caregivers have young children, this is what we call the sandwich generation. So people are not only taking care of those in their home and attending to the household duties, but also caring for their loved one where they may have to transition them into higher level of care, or sometimes the caregiver is living with them at home. Then as you transition to the caregiver at the empty nest stage, this is when children launch out of the home. The caregiver is more one-on-one with their loved one. So they have more opportunities to talk and interact with them. This, however, is where a little bit more conflict and resistance comes into play, sometimes because of a lack of outside family involvement. And caregivers in the later life stages may have this one-to-one interaction, but caregivers can also develop other health issues and complications, which is why it's really important at the empty nest and later life stages that more family outside involvement is there and supported for. So we talked about some of the time phases of illness. Here are some specific questions that healthcare providers can ask caregivers at these different stages. For instance, how did you, the patient or the family, react to the news about a loved one receiving this diagnosis? Who have you included in the news about speaking about the diagnosis? Does the couple or family choose to keep it more internal, or do they want to talk about the disease to outside family members as well? What's the meaning making that the family has around the diagnosis? So again, we talk about the narratives that caregivers and patients have. It's not always one-size-fits-all approach. And what is it going to look like moving forward? So how is the caregiver going to plan the necessary steps in helping their loved one, talking to other professionals, looking at other resources? It's important these questions get asked right after the diagnosis is made. Now going into the chronic stage or the long haul stage, specific questions also have to be asked even if the caregiver's been taking care of their loved one for several years. One question professionals can ask that despite some symptoms getting worse around the disease, what does the patient and caregiver still feel they have control over in their lives? And this is important because this comes from more of a strength-based perspective where we're looking at what the caregivers are still doing well despite some challenges in the caregiving process. How has the family continued to interact across the course of dementia? So really this question is looking at what other family resources, communication, conflict resolution is the caregiver and family using? And this is important because as a collaborative process, the family has to work together during this long haul. Then we look into some of the more deeper rooted feelings, thoughts, or emotions taking place with the caregiver. So a question, are there still unknown thoughts, feelings, or fears that you still hold around the disease itself, is really an important question, looking at the mental health and well-being of the caregiver over time. Now talking about the terminal stage, healthcare professionals have certain questions they need to ask caregivers during this time period. For instance, what are the family's fears about the process of dying or anticipatory loss itself for their loved one? And this is important because there are certain expectations that caregivers and family members have in how this process will work. The second question, how does the patient and family members want to create their own meaning with the time remaining? This is important because families not only need that time to interact with their loved one going through these end-of-life stages, but also their family regarding bonding and really having a sense of closure for the situation. The third question, how will the family redefine their roles in this final stage? And that's important because, as we talked about, the caregiver has so many responsibilities on them through this process that outside help is going to be critical. And really looking at the caregiver's well-being is going to be important for families to look at. In addition to these time phases of illness, there are certain issues that caregivers need to check in with over time. The most important thing during that initial crisis phase is the information about the diagnosis itself. Not only explaining about what dementia or Alzheimer's disease, for instance, could be, but certain medications, side effects, what types of resources that the family is going to look after. Areas of support is also very critical at this stage too. So not only involving family, but what outside neighborhood or community support areas does the caregiver have in their own life? There's a lot of resistance that takes place throughout any of these phases. So it's really important for the caregiver to know that there's denial, resistance, communication, conflicts that could arise. So professionals need to really check in how the caregiver is doing with that, and offering some skills helps. There could be certain mood issues that occur, and this may be separate from the dementia itself. So healthcare providers really should make that distinguished at the front end around if depression or anxiety or other issues are taking place for them to consider. Some other more concrete areas such as financial decision-making, driving safety issues, and advanced directives are important. How is the caregiver managing the finances or bills of their loved one? Is this person unfit to drive, and how is their physician going to have a conversation around this? Are there advanced directives or a healthcare power of attorney to help the loved one make a decision around the person with dementia and the course of their disease? Caregivers may go through a lot of burnout and compassion fatigue stages. So how does the healthcare professional check in around these needs across time? And then as people get more advanced with the disease, what are transition of care looking like? So what is cost for coverage of insurance areas? What quality of services are out there? The healthcare provider should really have a conversation with the caregiver around this. So these are some of the most critical areas that healthcare providers need to be aware of when working with caregivers in practice, but we encourage professionals to consider other areas as well to make a more comprehensive care for the caregiver and family. Now I'd like to introduce Dr. Sue Tebb, my colleague, who will be speaking on resources and support services for caregivers and what healthcare professionals can do to make this process easier for them.
Hi, I'm Sue Tebb, and as Max said, we're going to be talking about some of the resources that we have for caregivers. As you look at this slide, you notice that healthcare providers are not there at all, and they could be one of the greatest resources that we have. So as a healthcare provider, we realize that we are not necessarily talking to caregivers as much as we should. A study several years ago by the Alzheimer's Association found that over half of the caregivers were never asked by healthcare providers how they were doing. So we need to be able to do that. As Max said earlier, this is a really hard phase of life people go through when they're caring for a loved one with a dementia. So we need to ask how caregivers are doing, what caregivers are doing, and what needs they might have. There's a lot of evidence out there that says we should be engaged with caregivers during this time. But as I noted earlier, the research shows that we are not. We need to help caregivers learn caregiving skills. You don't just wake up one morning and know what kind of medications to give and the amount to give, how to take care of someone in their bed, how to help one in and out of a chair. So we need lessons and caregiving plans for people to learn these activities. We also need to be able to help people make better discharge plans, both from hospital and also from home. So when it's ready and time for one to leave home and go to a long-term care facility, have we been able to help caregivers make the best plan possible for themselves and for their loved ones? We're also learning with technology that there are many different ways that we can help caregivers learn, both online, through both assessments online and also training online. One of the more important things that we need to do as we help people learn is to be very aware of cultural appropriateness, both for interventions and access to services, because it differs for many people depending on where you live and also the resources that you have. So as a healthcare provider, how can we best help caregivers as they help their loved one through this period of time in their caring? We need to always assume that caregivers need support. And we also need to accept caregivers as members of our team. For me, this is one of the most important things that we as healthcare providers need to do, is to make caregivers our team members. In fact, I believe they're probably the most important team member that we have on our healthcare team. Providers also need to be able to engage caregivers about their needs and their well-being and ask them, as I mentioned earlier, what are they doing for their own self-care and what are some of those needs that they have, so that we can begin to plan as caregivers to help those caregivers provide for them. Providers also need to know what resources are available. Are they easily accessed? How much are they? Are they available in the area in which they live? Are they culturally appropriate? And also, do they meet the needs that caregivers have? Providers also can integrate regular caregiver assessment and interactions into the care recipient encounters. So that means as we work with the person with a dementia, we can also do an assessment on our caregivers. At St. Louis University, we have a website, aging.slu.edu, that's available for both healthcare providers and also caregivers of people with a dementia. On this website, we have some modules that have been developed by the Health Resources and Services Administration, particularly for caregivers and also for healthcare providers. Also on this website, we have a manual for healthcare providers to help facilitate caregiver support groups. This manual includes how to run groups, how to help caregivers with some behavioral problems that they might be having with their loved ones, and also it has a section on health and self-care for the caregiver. We also have a rapid geriatric assessment that's been developed just for caregivers. It's a very short 6-question assessment that healthcare providers can ask every time they meet with a caregiver to see what needs a caregiver might have. We also have some resources that we have put up on the website and will be adding to periodically, particularly for healthcare providers. And then also there's a section for caregivers themselves. And we have divided it where it's available for people across the United States, but then also locally for the St. Louis population. This particular slide talks about the resources that we have that have been developed by HRSA, particularly for healthcare providers. There are 4 modules that have been developed particularly for healthcare providers by HRSA. The first one helps healthcare providers begin to look at a caregiver as an ally, a teammate, and also talks about some of the challenges that they have as a caregiver. The next one talks about how we can help healthcare providers and caregivers make decisions around transition of care and some of the risks that come up when one cares for someone with a dementia. The third one talks about how we can effectively interact with caregivers and provide some communication skills and some assessment tools that we can use as we bring the caregiver into our team. And the last one talks about how we can help caregivers care for themselves while they're taking care of a person with a dementia. This slide talks about the resources that HRSA has developed particularly for caregivers. There are 9 of them. The first module talks about, are you ready to be a caregiver? And it includes an assessment tool that looks at your readiness to be a caregiver. The next module welcomes someone to the caregiving process. The third module talks about the role that a caregiver needs to take and to be an advocate when they're living with someone with a dementia. The fourth module looks at some of the resources that are there when you're working with a healthcare provider and having to make shared decisions both with yourself and with your family members and the healthcare provider. The fifth module looks at caregiving supports for self-care as you are in that role as a caregiver. The sixth module is working with a healthcare team, making yourself part of that team. The seventh module addresses some of the behaviors that you see in the person that you're taking care of with the dementia and how you as a caregiver might be able to better address those behaviors. The final 2 modules look at transition of care, both into an assisted living facility or into a nursing home, and helps you make some choices when that transition occurs in your life. This slide reminds us of the manual that we have provided for you as a healthcare provider if you're wanting to have a support group for a caregiver. So included in our manual is a healthcare well-being scale that helps a caregiver and a healthcare provider look at how well a caregiver is providing. This scale's been developed as a strengths approach to caregiving. Also included on the website, we have resources both for healthcare providers and also for caregivers. This slide gives you an introduction to some of the resources that we have for healthcare providers, while this slide gives you an introduction for the resources that we have for caregivers. For more information, you could go to the Gateway Geriatric Education Center by going to aging.slu.edu or calling us at this number 314-977-8878.